Hi, I am Rani Chaudhari. I am 45 years old. I have been suffering from PCOD, PCOS, fibroid, adenomyosis, adhesions, endometriosis for almost 10 plus years. I have gone 7 cycles of IVF. All of them have been a failure, maybe because of these diseases that I have been carrying. Last 7 years my case has deteriorated a lot and I've been suffering from severe bleeding almost 20 days in a month, pre-period, during period and post period. I have been in pain, almost 3 painkillers every day, so which has been carried on for last 7 years. I did visit a gynecologist doctor in Hyderabad in 2017, when doctor did suggest that you should now go for surgery, uterus removal. But along with that, doctor suggested that the surgery is going to be very critical because of your case, that which was a big concern for me and my husband, and we were like kind of delaying the surgery because my son was very small. Quality of life, I would say, was like zero. I am a chartered accountant I'm in a senior position in my company, but I was just working and taking rest, and all credit goes to my husband, who was bearing all the pain along with me, taking care of my son, taking care of the family, taking medicines, almost 3 painkillers as I said, and if I need to score my pain, it was on 10 on 10. But only the fear in the mind that post surgery I'll have lot of more complications, we delayed the surgery for 7 years. Last 2-3 years bleeding has been enormous. I mean, I cannot even explain it. It was just like a post-delivery bleeding as any woman would have. So we were deciding when to go for surgery, and then my husband started searching for best gynecologist in Hyderabad, and that is how he came to know about Dr. Rooma Sinha. When I was in MRI room, I was just keeping my fingers crossed that whatever happens to my reproductive, nothing to the other organs, because I need to go back all fit and fine for my family. So your emotional connect, when I stepped out from your room, I told to my husband, "Meko to yahi chahiye," because more than the speciality, I need that connection. So that is how we came to you, and in fact I remember the first instant you asked us after seeing the MRI that you want to go for robotic or non-robotic, right? And we told you, whatever best for me, just do it, doctor, I am in your hands. And you said go for robotic. But we did bit of a reading and bit of a YouTube search and all, so it was clear that it was a surgery done with the help of robots, but those robots are just the instruction takers. It's all about the doctor who gives the instructions, right? So it's just doctor not stepping inside your body and a robot stepping inside, but the speciality of doctor counts. So that is what we read and came to you. When I came out from the surgery room, actually I didn't feel, because obviously that time I was on the painkillers and all, and it was there in my mind that now I will be on painkiller for God knows how many months. But trust me, it was only the 6th day I took painkiller, though doctor suggested me that try to reduce painkiller as soon as you can, but I trusted my doctor and I stopped painkiller on 7th day. There was a mild pain but a bearable one, and 6th day I took painkiller, after that none. But after that I am fit and fine. Nobody would say that I have gone to such a big surgery. I have gone to my hometown in Kolkata, and nobody could even guess that I have gone to such a big surgery. So all thanks to my doctor, it has been a very smooth surgery, beyond our expectation. I am absolutely fit and fine. Touch wood, no issues at all. I'm not even feeling like I've gone through a surgery. Say to all people or all women who are suffering for this kind of an issue, if you need to go through a surgery, don't scare at all about robotic surgery, because robotic sounds little bit gamic for us who are non-medical people. But trust me, more than the full cut of surgery, where the recovery time, just like a C-section ladies, right? They take a lot of time to recover. So robotic surgery is completely safe. I will not say painless, but quicker recovery. So for a working woman, for a non-working woman, even if we are non-working, we have to take care of a household task, right? So definitely go for robotic surgery. It's nothing to worry about. Nothing to worry about.
Mrs. Rani Gupta came to us with years of suffering and burden. it was not just the pain that she was suffering from. It was also the emotional reaction to her series of events that happened in her life. Had multiple laparoscopic surgeries in the past, tried many cycles of IVF which she did not conceive, and then suffering from pain almost every day. The quality of life was poor. The background disease, endometriosis, adenomyosis, adhesions, and so on and so forth. When she came to us, my primary objective to her was to relieve her of pain. And I realized that surgery was probably the only answer. The surgery, I realized, would be tough from a surgeon's point of view and difficult from a patient's point of view to go through. And that is where I chose the robotic surgery way. I realized that after doing robotic surgery for more than 1 decade, that patients who have complex problems, like Mrs Rani, having a complex array of problems of endometriosis, adenomyosis, bowel adhesion, bladder adhesions, and so forth, would be best with a precise technology of robotic surgery, which gives us magnification 3D vision, gives us the precision to do wrist-like surgery, and I knew that we will be able to give her the life that she wanted. The surgery for me as a surgeon was not easy. When we entered the abdomen, we realized the whole abdomen and pelvis was packed. We could not realize where the intestines started and where was the uterus. It took us an hour to go through the adhesions to be able to even identify a little bit of the pelvic organs. And then the surgery began. We had to remove her uterus, both the ovaries, clear all the bowel adhesions, clear the bladder adhesions which were stuck up to the fundus of the uterus, and it close to 3.5 hours of very meticulous surgery to give the kind of response she needed. But today, we are so glad that she has recovered from this surgery without any problems, no complications. Her bowel, bladder, ureters are all intact. She has now does not have the disease that she was suffering from years together. And as a surgeon and as a hospital, we are very happy to give the quality of life back to her, which from in her own words, we could realize that she's so happy to be back to her child, back to her husband, taking care of her family, and very soon go back to the work as a chartered accountant. So this is the power of technology. This is the power of the newer things that we try to do so that we can give the better clinical outcome to patients. Thank you.